So this is an article you guys probably, you guys weren't in med school yet, neither was I. This was one of those sort of like, this is horrifying like statistics. We all have a ton of them, but did anyone hear about the study that African American men in Harlem had a lower life expectancy than Bangladeshi men? And as we all know, it's like a poor third world country, right? How could it be that that's the case in this country? And that was released in 1990, and then they did another follow-up study in 2000. They're like, is this still true? Yes, it is still true. They still have lower life expectancy. And what's really, and just to remind you, the gross national income of Bangladesh versus the US, our gross national income is 200 times that of Bangladesh. And their poverty line is 3 times ours. And so it's horrifying. Like, I remember the statistic and just being like, just like drop the microphone, right? Like, there's nothing else to say about this anymore, right? So yeah, things are just not slowly getting better, I think, as we all recognize. So in 1950, the ratio of age-adjusted death rates, black folks to white folks, was 1.6. And in 2000, it's actually literally the same, 1.6. As we all know, education plays a even larger role in health outcomes than like access to medical care or anything that we can do in the clinic room, right? So education is really, really important. And what is just so horrifying to me, so look at this. So in the 1950s, this is when we started doing sort of like forced integration, right? And at that time, this is the percentage of black students in majority white schools. So we had this forced integration that sort of happened. We actually hit a peak in 88. And then since then, we've actually been moving backwards. So like kids who are growing up in elementary school right now are living in a more segregated society than when we went to school. So this also gets to the idea of like social determinants of health, right? So you guys might be familiar with this. This is Robert Wood Johnson, so famous, blah, blah, blah. And we always talk about now in the past like 15 years more about the social determinants of health, right? And I think it's very humbling for us doctors to realize that like this is us, right? And like this is everything else. And very rarely do I disagree with Robert Wood Johnson. But there's something that's invisible on this graphic, which is racism, right? And it's sort of expressed in the sense that like racism impacts every single one of these things, right? But as an entity, it's one of those like silent things that we kind of understand, but like don't like saying.
Should it be like squashing the whole thing?
Yeah, right. Like I was like trying to like make this presentation, and then I was like, oh, maybe I should do like a curtain overlay or like really make it like fake. But like PowerPoint wasn't doing it. It was like 2 in the morning. I was like, forget it. They can use their imaginations. And so I think the question is, as doctors, what do we do about this information? So beyond this idea that like we have to be more understanding about the context in which our patients live, right? Like I'd like to think that I can get anything done, but like that the likelihood of me impacting any one of these things on a large scale in the rest of my career is pretty low, right? And so that's why I think implicit bias is so important. So I think it's really easy for our medical colleagues. We frequently talk about social determinants, and it's so important. I feel like when it first happened because it helped open people's eyes to like what social inequities exist. But on the other hand, I think it's really caused medical providers to sort of wash their hands of poor outcomes, right? They're like, oh my God, it's not my fault. I can't fix the bus system. I can't fix this education. Like I can't fix the fact that there's no grocery stores in their area, right? So this is not my fault. It's like everyone else's fault, right? Policy has to fix this. And to a certain extent, that's obviously false. I think all of us would agree that like public health is something that's very, very important for doctors to all get involved in, especially family medicine. But even beyond that, implicit bias is something that is so important because it doesn't matter whether you're capable of working outside the confines of your clinic, right? We are all going to be seeing patients. Okay. How often do you think your own racial biases impact